Well, top infectious diseases expert Dr Anthony Fauci says the J&J COVID-19 vaccine should have been administered over 2 doses from the very start. He said this shortly after a United States advisory panel unanimously supported booster shots of the single-dose vaccine for adults over the age of 18. The panel also recommended that if you've been vaccinated using the single-shot vaccine, you are allowed to get a second dose regardless of age or any underlying conditions. Well, to discuss this further, we asked the lead investigator of the Sisonke implementation study, Dr Glenda Gray, about what she thinks. She joins us now on Zoom. Dr Gray, thanks for joining us. That FDA report saying there should be a second dose, what's your take on it?
I think it's wonderful news. We must remember that the first dose was developed as an emergency response. And so the second dose data only came out 8 months after the first dose data. So had we waited for the data for the 2 doses to come in, we wouldn't have been able to roll out the emergency response, which would have been 8 months delayed. And so the single dose provided evidence that this vaccine saved lives and saved hospitalizations. And so we know that the first single dose J&J vaccine worked and provided the healthcare workers in the country with protection against death and hospitalization. Had we waited for the 2-dose regimen to come in, we would only be implementing the 2-dose regimen right now. And so we gained 9 months of protection, and now we can start thinking about boosting the healthcare workers that got the single dose. But this single dose regimen was an emergency response, and it provided millions of people all over the world with protection. And the evidence around the second dose is important, but it doesn't mean that the first emergency response was inappropriate.
Do you know of any plans afoot to provide the second dose to frontline workers and anyone else who was in the trial, as well as journalists, for instance, who received the J&J?
Sure. So we've just submitted to SAHPRA the boost for the Sisonke subjects. We've been working with the Department of Health, with J&J and SAHPRA to deliver a boost strategy to the healthcare workers. And we hope to be able to deliver this boost to the healthcare workers in early November. And so we're now working with SAHPRA and working with the Department of Health to end with the electronic vaccine data system to see how we can offer the healthcare workers the adeno 26 boost. So we're very excited to be able to do this, and we're working very closely and we're rapidly implementing processes to give the boost to healthcare workers in South Africa.
There's also talks about, booster shots for Pfizer, for instance. Is this to increase the efficacy of the vaccine or to give us more time?
So there are 2 strategies. One is the 3rd dose mRNA for the Pfizers. So we've seen at a US level and other parts of the world is that the 2-dose mRNA needed a booster shot 6 months later because of the Delta predominance in those areas, and there was evidence of waning efficacy. And so we're seeing a 3rd dose of Pfizer being offered in other parts of the world. There has been some immunogenicity data in small studies looking at a J&J first dose and a Pfizer second dose, yet we don't have any effectiveness data on that. So we know that there's good immunogenicity, and the question now is whether that increased immunogenicity translates into a durable immune response. Fortunately for the J&J vaccine, we have data that tells us that a 2-dose J&J vaccine is effective and can be implemented immediately because we know it works.
Very quickly, Dr. Gray, just SAHPRA saying yesterday that Sputnik vaccine is not yet coming to our shores. What did they highlight as one of the main issues with it?
So the Sputnik vaccine is an adeno 26 prime, like the J&J, and an Ad5 boost. Now, the Ad5 boost that they're using is a first-generation adenovirus vector. And this first-generation adenovirus vector was associated with an increased susceptibility to HIV acquisition in men in South Africa and abroad when it was used in an HIV vaccine. And so there are fears that this first-generation adeno 5 vaccine will increase men's susceptibility to HIV if they take it. And so we need new data and more data to make sure that the adeno 5 vector is safe, and we need to know that the vaccine has, that what kind of adeno 5 platform has been used. And so we can't use the adeno 5 platform in this country until we know that it's been re-engineered and that it doesn't cause harm in men.
All right, thank you so much, as always, for your time. You're a very busy woman. Dr. Glenda Gray, the lead investigator of the Sisonke implementation study.